Hi. Psychological injury and illness is real. That kind of goes without saying in this day and age. And if you work in healthcare, then your job comes with certain factors that can affect your mental and your psychological health, more than if you didn't work in healthcare. That sort of also goes without saying in this day and age. So it makes sense that if you are in healthcare, that you should do more for your mental health than if you aren't in healthcare. My name is James, and I know this is just a video, but if you get anything from this online in-service, I want it to be that it just makes sense for your first and foremost responsibility to be to take care of yourself. Don't light yourself on fire to keep others warm and all that. You have to take care of yourself to give care to other people. Body and mind. So let's talk about that. The truth is that we don't really know that much about mental health, at least not as much as we do about physical health. But we can use what we know about physical health to help understand mental health. Here's what I mean. For physical health, you can be physically healthy but have a physical illness, like an athlete getting a broken leg. Or you could have poor physical health without having a physical illness, high blood pressure or cholesterol. But we know that if you have poor physical health, it can lead to developing a physical illness. Poor diets lead to diabetes. Mental health is the same. You could be mentally healthy but have a mental illness. For example, people with bipolar disorder can live relatively normal lives with proper management. Or you could have poor mental health without having a mental illness, like stress and unhappiness. And just like with physical health, poor mental health can lead to developing a mental illness. A lot of stress can lead to anxiety disorders or depression. And lastly, whether it's mental or physical health, if someone has an issue, there are symptoms, ailments, and signs. It's just that with mental health, it's less easy to see, even in ourselves. In the end, whether we're talking about mental or physical health, we're really just talking about health. The ancient Greeks believed that mental health and physical health were interrelated, and for someone to be well, both their mind and their body should be in harmony. Once we start to think of our mental health like we do our physical health, it starts to make sense that we can do things daily that will help us mentally, right? Call it mental health hygiene. We can exercise and brush our teeth for our physical health, so we can also do things like that to help our mental health. Think about your mental health like it's a bucket. It can only take so much from life before it gets too full. By being proactive and doing daily mental health hygiene tasks, you build up your resilience. In other words, you're making your bucket bigger. So the next time that life comes around and tries to fill it up, which it always does, you'll be more ready. You won't overflow. When negative situations or events happen to you in your life, you'll have a better ability to become healthy again. But what are those mental health hygiene activities exactly? Well, you might already be doing them. If you do something that helps you to relax, it's probably good for your mental health. But in the next video, we'll get specific, and we'll talk about what you can do on a daily basis to help aid your mental health. But between now and when you watch that video, I want you to consider this question. What do you already do in your day to help your mental health or to build resilience? And I'll see you then.